Hi, how are you? My name is Stephanie. I'm a nurse practitioner student at Sacred Heart University, and I'm going to be performing a muscular skeletal assessment today on you. Can you just confirm your first, last name, and date of birth for me?
Mark Anthony Lynch, 9/11/06.
All right. Do I have permission to record you?
Yes, you do.
All right, thank you. All right, so I'm just going to perform hand hygiene. All right. So what I'm going to have you do is, what we're going to start off with is I'm going to have you stand up. Good. All right, so I'm just kind of assessing for asymmetry, any deformities, nodules, any tenderness, swelling, anything. We're just going to take a quick look. Sorry. I'm just going to do that. All right. Good. So it's normal. Good. I'm going to have you shrug your shoulders up. Good. So we're kind of assessing for strength. All right. Good. Down. All right. And then I'm going to have you look straight ahead. All right, so we're going to now assess for your temporal mandibular. You're going to go erect out like this. Good. Side to side. Good. Do you feel any cracking or anything? No? All right. I'm going to have you look straight up, range of motion of your neck, and then all the way down to the left. Look right to the right. Good. All right. And then what we're going to do is I'm going to have you turn. We're going to assess your spine. I'm just going to tie this back up for you, okay?
Got it. Thank you.
All right. So before I tie that, actually, so look straight ahead. Good. So we're assessing the cervical area, which should be concave. And then the thoracic, which should be convex, as we go down to the lumbar, which is concave, into the sacrum. All right. And then now I will tie this for you because we're going to now. All right. So let your arms hang and you're going to bend down as if you're touching your toes. Good. I'm assessing for any abnormalities from the spine, for scoliosis. So as you come back up slowly, Good, good, good. I'm palpating the spine to feel. So it's normal, no scoliosis. Good. All right. So what I'm going to have you do is you're going to walk from toe heel. Good. Good, 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 good. All right, turn. All right, look straight ahead, put your feet together. All right, and then you're gonna touch your nose with one hand, good. And then the other one, good. And then now I'm gonna have you close your eyes. Look straight ahead, close your eyes, and touch your nose with one hand, good. And then the other, good. All right, come back over here. I'm gonna have you sit. All right, so what I'm gonna have you do is I'm gonna have you extend out, good, and then in, good, same thing, out, and then in. All right, and then I'm just feeling on the patella, and then on the lateral side, and then the media, and I'm going to push down. All right, I'm gonna push down. When I push, you're going to extend. All right, pull back. Good. Same thing. Push out. Good. Back. I'm pushing down to see, and it's normal. You don't feel any pain, anything? All right. I'm going to have you put your hands out. Good. All right, so what I'm going to have you do is you're going to abduct your fingers. Good. All right, I'm going to go like this, wide apart. All right, so I'm just now going to assess for any, for the distal phalanges, we're going to start into the proximal. I'm feeling for any nodules, any fluid, heat, tenderness. Are you feeling any pain when I'm doing this? We'll do the other side. Going all the way down. Good, good. All right, put your fingers, now you're going to adduct your fingers together. Go like this. Good. Back up. All right, turn. Good. Straight ahead. And now what I'm going to have you do is turn your hands like this. and we're going to assess for carpal tunnel. So this is called the Snell sign. So you're going to go like this. I'm going to look for the medial nerve, and I'm going to tap, and you're going to let me know, do you feel any numbness, any tingling, loss of feeling?
No.
As I'm doing that. All right, same thing we're going to do. Any no?
No.
All right, so another test for carpal tunnel that you can do is the Fallon sign. So you're going to put your hands in prayer position, like this, and you're going to kind of extend your elbows out and put pressure right on the bottom area, kind of where that medial nerve is, and you're going to hold for approximately 2.5 minutes. And during that time, after holding for about that long, I'm going to assess for if your thumb, your middle finger, or your lateral ring finger, if you feel any of that numbness, tingling, anything when doing that. All right? All right, good. I'm going to have you release. All right, so I'm going to have you flex the elbow joint. Good. Extend. Good. I'm going to have you stand up one more time. All right, so for your shoulder, what I'm going to have you do is you're going to put your hands to your side, and then you're going to extend arm all the way up. Good, good, good. Keep going. How far? Are you feeling any pain, tenderness, swelling? No? Good. Go back down. Same thing with the other arm, all the way up. Keep going. Slowly. With your hands, put your hands like this. All right, with your hand like this, now do that one. Are you feeling any pain? No? Down. And then put your hand in front of you. Okay? And you're going to go all the way up. Good. Any pain? Nope. Next arm, same thing. Your hand in front of you like this. Go. Keep going, going. So you would be assessing if they had like a tear or anything or any pain, if they couldn't, if their joint was out of socket, if you would be able to tell it would be abnormal, it would be hanging more. And if there was any like a bicep tear, we would also be looking for bruising and stuff like that, because that would be a red sign for that. All right, good. So now what I'm going to have you do is I'm going to have you lay down. Okay. All right, so what I'm going to have you do is you're going to push your leg up. I'm going to push down, you push up, okay? All right, go. Feel my hand, good. Next leg, same thing. Good. Push down, good. And then I'm going to have you rotate, so I'm going to have you extend, we're going to bend. So this is passive range of motion because I'm helping him do it. All right, to the side. Any pain? No? Good. Same thing, we're going to bend, passive range of motion. Side, rotate, good. All right, and then what I'm going to have you do is I'm going to have you extend your leg up. So this is active because he's doing his own. I'll have you do the next leg. Good. All right, and then for your feet, now I notice on this patient has flat feet, which could be an issue for posture. If I was looking, his legs actually look a little off in height, but we'll get to that another day. All right, so what you're gonna do is you're going to, like you're pressing a gas pedal, press down on my foot for strength, for assessing, good, release. I'm gonna have you extend, good, go back down, good, and then kind of, does this hurt? Rotate to the side, good, all right. All right, I'm gonna have you sit back up. Okay, how do you feel? Do you have any pain, tenderness, any swelling, any issues with anything?
No.
Good?
I'm good.
Okay.